Hello, my name is Crystal Johnston, and I am an LPN to BSN nursing student at Indiana State University, and I will be presenting my health education project for community health nursing. The title of this presentation is Preventing and Managing Skin Damage, and I will be discussing how sun exposure affects a certain population at risk, which is older adults living in areas of high sun exposure with increased risk of skin cancer. The learning objectives for the audience are that the audience will define skin damage from sun exposure and describe implications of skin damage. The audience will list the risk factors associated with skin damage. The audience will describe the signs and symptoms of skin damage. The audience will utilize interventions to prevent, recognize, and manage skin damage. The audience will utilize other sources of information to learn more. Before I begin the presentation, I have included a short pre-test for you to complete. Please pause this video presentation and click the link below. There is also a link to a handout to use when following along. What is skin damage from sun exposure? Skin damage from sun exposure occurs when the skin is exposed to sunlight and ultraviolet or UV light damages DNA and causes skin cancer. Sunburns increase the chance of getting skin cancer, but UV light can damage skin without causing a sunburn. Skin cancer is prevalent in America, with an estimated 1 million cases being diagnosed each year. 70% of which were caused by repeated sun exposure. Reducing skin cancer is an objective of Healthy People 2020. Anyone exposed to the sun has some risk of skin damage, but some people are at higher risk than others. Age is a risk factor because of photoaging, which is the cumulative skin damage because of sun exposure throughout life. The older a person is, the more sun they have been exposed to throughout their lifespan. People who live in tropical climates or at high altitudes are exposed to more UV light than those who live in other areas. People who spend a lot of time outdoors, either working or recreating, have higher exposure to UV light. Another risk factor is medications that cause photosensitivity, which causes the skin to sunburn really easily. People who have a history of other cancers or have autoimmune disorders are at higher risk, as are those with fair skin, freckles, or moles. Having a family history of skin cancer increases a person's risk. People who burn before tanning are at higher risk for skin damage. And other risk factors include having many blistering sunburns in childhood and using tanning beds. Signs and symptoms of skin damage from sun exposure include suntan and sunburn, dry, flaky skin, signs of photoaging such as freckles, wrinkles, melasma, which is grayish-brown patches on the skin, and texture changes such as leathery-looking skin, deep lines, and waxiness. Easy bruising on areas of sun exposure is another sign of skin damage, as are moles that change shape, color, size, feel, or moles that start to bleed. Any lesions with an irregular border or lesions that itch or burn are signs of serious skin damage. And actinic keratosis, also known as cancer spots, are another sign of serious skin damage. So how do we prevent skin damage from the sun? Sunscreen is a great way to protect the skin. Sunscreen should be applied generously and often whenever exposed to the sun, and reapplied every 2 hours when swimming or sweating. Wearing protective clothing when in the sun, including long sleeves, pants, and a wide-brimmed hat, is another effective way to protect the skin. Other prevention strategies include staying in the shade when possible, avoiding the sun between 10 a.m. and 3 p.m. when the rays are strongest, being extra careful around water and snow since these reflect the sun's rays, getting plenty of vitamin D through the diet, avoiding using tanning beds, use a chapstick with SPF, and wearing sunglasses with UV protection. Recognizing skin damage is important for early intervention if there are problems. It is best to examine your skin on a regular basis to detect any changes. Use the acronym ABCDE to recognize when to contact your healthcare provider. A stands for asymmetry, meaning one side of the mole doesn't match the other. B stands for border, as in irregular border. C is for color, as in color that is not uniform. D is diameter greater than 6 millimeters, or approximately the size of a pencil eraser. And E is for evolving size, shape, or color. If there are concerns, a biopsy may need to be performed to rule out skin cancer. Managing skin damage. Sunburns are managed by quickly cooling the skin, moisturizing the skin, decreasing inflammation, drinking plenty of fluids, and seeing a doctor if blistering or oozing pus, which may indicate infection. Actinic keratosis. Various topical medications may be prescribed. Cryotherapy may be used. Other treatments include chemical peels, laser resurfacing, shave excisions, and photodynamic treatment. If skin cancer does occur, then there are various treatment options depending on type, location, and stage of cancer. This includes surgery, radiation therapy, and chemotherapy. Other treatments may include photodynamic therapy, immunotherapy, and chemical peels. In conclusion, skin damage is caused by UV light from the sun. It damages DNA and can cause skin cancer. Risk factors include age, geographical location, medications, personal history of cancer, family history of skin cancer, fair skin and freckles, moles, blistering sunburns in childhood, and use of tanning beds. Signs and symptoms include sunburns, photoaging, changes in moles and lesions, and actinic keratosis. Prevention includes diligent use of sunscreen, wearing protective clothing, seeking shade, avoiding the sun when the rays are strongest, being cautious around snow and water, which will reflect UV light, increasing vitamin D intake, avoiding tanning beds, using chapstick with SPF, and wearing sunglasses with UV protection. Screening for skin damage includes regular self-examinations, using the ABCDE guide to know when to contact your provider, and possibly a biopsy to rule out cancer. If skin damage does occur, it can be managed by treating sunburns and seeking treatment for actinic keratosis and skin cancer. For more information, visit the American Cancer Society's website, Healthy People 2020, the Skin Cancer Foundation, and the National Cancer Institute.